and then unmute myself so we can hear her.
Everyone can hear you right now. Good afternoon. I'm so pleased to have so many of you on the line for our Parents and the High Cost of Child Care webinar. I am Lynette Fraga, and I am the Executive Director for Child Care Aware of America. Given the number of individuals who are on the phone, we certainly understand and know what an important and critical topic this is for all of us across the country. As many of you know, 11 million children younger than age 5 are in some form of child care in the United States. And the Parents and the High Cost of Child Care Report 2015 summarizes the cost of care across the country. This is the 9th year that Child Care Aware of America has published this data. Unfortunately, the picture for families has not improved during this time, and child care remains one of the most significant expenses in a family budget. In many states, child care exceeds the cost of housing, college tuition, transportation, or food. Unlike all areas of education, including colleges and universities, families pay the majority of costs for early education for young children. These costs generally come when parents are at the beginning of their careers, a time when families can least afford them. Child care impacts more than just individual families. While access to high-quality care increases morale and employer loyalty, child care problems impact workers, families, and the economy, costing over $4 billion every year. The science is clear. There are long-term positive outcomes when children begin learning from birth, and for the millions of children in America each week, affordable quality child care settings with well-qualified, trained staff are critical opportunities for children to learn and set healthy habits for life. The reauthorization of the Child Care and Development Block Grant in 2014 represents an enormous step forward in establishing access to quality, affordable child care for all children and families. However, more work still needs to be done to ensure that Congress and states are implementing all of the CCDBG requirements effectively and expanding access to child care for all. We are excited to give you an early look at the Parents and the High Cost of Child Care 2015 report this afternoon. The report updates last year's report and also examines the dual importance of child care as a workforce support and as an early learning program. It describes the changing demographics and the impact on child care across the country. It includes a new interactive map that we're very excited about that allows users to examine the cost and affordability of child care across the country and ranks states according to their affordability for infants and toddlers, 4-year-olds, and school-age children, compares the cost of child care to other family expenses, explores the effect of the cost of care on parents' child care options, and examines the cost of child care in 5 urban areas and compares these costs to statewide averages. It is an exciting time, and we are on the cusp of great leaps toward improving child care in this country. This report will help inform the important discussions ahead. I'll now turn it over to Dr. Dionne Dobbins, Senior Director of Research at Child Care Aware of America, who will share the major findings from the report. Dionne?
Thank you, Lynette. I really appreciate your introduction. As you know, every week in the United States, we have nearly 11 million children or younger. 11 million children younger than age 5 in some sort of child care arrangement. Most are in center-based, and they're followed by grandparents or relative care. And the remaining are in family child care or family or child homes or in family friends and neighbors. Many are in multiple settings as parents attempt to secure care throughout the day. And on average, these children are spending 36 hours a week in child care. Now, things are changing, though. We are really looking at a different group of kids that we're working with. 40 years ago, less than half of the mothers worked outside of the home, and only a third of the mothers with a child under age 3 worked outside of the home. Now we have about 75% of mothers with children aged 6 to 17 in the labor force, and 61% of those mothers are have children that are under 3 years old. And women with infants are least likely to be in the workforce, with a participation rate of about 57%, which is still pretty high. Single parents and unmarried mothers are more likely to need access to affordable quality care. We also know that 1/5 of the parents with children under the age of 13 work non-standard schedules. Many of these people many of these workers have lower pay and few benefits. They're typically low-income workers that operate non-standard schedules, and they're more likely to do that, 28% versus 20% of the national population. These low-income families face irregular, unpredictable schedules that can often require last-minute adjustments. There are a few centers that will take these kids during the non-traditional hours, and there are a few that will offer care during this time. These families are least likely to seek child care subsidies because the subsidies often require minimum and consistent number of work hours per week. We also know that a lot of these families are students. We have student parents, and they're often loaded with debt, and they're juggling class schedules with their children's schedules, and they definitely need child care options, especially when we're looking at the millennial parents. They're coming into the workforce having lived through the recession and finding many of their household expenses unaffordable, let alone child care. We also know that there are a number of refugees and immigrants in our country. They now account for 25% of the 23 million children under the age of 6. That's compared to 14% in 1990. These children need dual language learning. They also need bilingual child care providers. But there's a lack of bilingual child care providers, and many of those in the workforce are substantially underpaid. Homeless kids. We know that during the year of 2013-14, the U.S. public schools enrolled over 1.3 million homeless kids and youth, including 50,000 that were the age of 3 to 5. That's not including kindergarten. And so as you can imagine, many of these children aren't accessing child care. There's many barriers for these families. They lack transportation. They have complicated enrollment requirements that might require them to have a home or a place to have an address. And we oftentimes child care centers have difficulty reaching these families and maintaining them. So in general, we know that the research shows that these vulnerable populations, these and the ones that I haven't listed, benefit greatly from access to quality and affordable care. And that's the issue. We know that affordable care is hard to come by. We also know that quality child care is a good investment. I know I'm preaching to the choir when I state that high-quality early childhood programs contribute to stronger families, greater economic development, healthier families, and more livable communities. And by now, everyone is aware of the science on the benefits of the quality of early care and education. Economists have estimated that the rate of return for high-quality early intervention is in the range of 6 to 10% per year for children with disadvantaged families. And long-term returns on investment can be as high as 16%. Workforce. We know that the workforce is very important. Our caregivers are the people who take care of our children. They're the most positive influence or effect on our vulnerable children. But we also know that these families are, these workers are very underpaid and tend to have low salaries and, like I said earlier, few benefits. Our research showed that child care workers need to spend an average of 81% of their income in order to afford center-based child care for their children. We also know that child care is a workforce support as well as an early learning program. And we need to ensure quality, affordable, accessible care, child care, is a reality for all families. In our report, we highlight some really great companies that are doing some interesting things around family-friendly policies, such as paid family leave and maternity leave, flexible schedules, providing subsidized care, and resource and referral. And we just know that parents are best able to work when they have stable, high-quality, affordable child care. We know that working parents need flexibility and working parents need support. Another thing that we report on is that 65% of the parents' work schedules are affected by child care challenges, an average of 7.5 times over a 6-month period. So business and workers are affected by absenteeism, the children as well. There's a definite cost to business. There's a business case for quality, affordable child care. Our adjustments for inflation show that U.S. businesses lose approximately $4.4 billion annually due to employee absenteeism as a result of child care breakdowns. So, what do we know about the cost of care? Let me tell you, we are very, very excited to share with you our new interactive cost of care map. This map allows users to quickly access a variety of cost data for each state, and it's available on our website. Right now, we have it on a special website for the members of this call, but I will show you what the interactive website does. All right, so as you can see, it will take you to this landing page that says cost of child care. It's a map that has all of the 50 states, and when you get to the landing page, you'll see that it asks you what's the cost of care in your state, and you can get information on the percentage of cost, the percentage of income, the cost of child care, and the infant cost in the center versus public tuition. If you look at the map, you can see that we have percentages of income. The states that are darker, it means that the percentage of income for a family is over 12%, and the ones that are less, that are lighter red, are under 10%. The middle is 10 to 12%. So let's pick a state. If you go to Texas, you'll see I clicked on Texas, the state turns white. As you can see, you can look at what it is for the percentage of income for a family who has an infant, a married family. So you can see we're looking at center on this side of the column, home on this side of the column, and we look at infant care for married families. So here, this would be 11.61%. 11.61% of their income would go toward infant care, for example. You can see that we talk about infant care for married families and home care for married families. 2 children for married families, center and home. This would be an infant and a 4-year-old. Infant care for single parents, 2 children for a single parent. Again, an infant and a 4-year-old. And married children with married families, with 2 children at the poverty line. We also look at the actual cost in hard dollars for of child care for center-based and home care for either an infant or for an infant and a 4-year-old. And the other piece that we look at is the infant cost in a center versus public college tuition. So we do that for every state. You'll be able to look at that for every state. Another nice feature that we have is you'll see at the bottom of each state, you'll see that we have the state name and a summary of some of the information that you find on the map for your state. So we're really excited. We're hoping you can use this map both at the state level and nationally as you're looking at child care. You can compare, and as I said, you can look at any of the states. And when you scroll over any of the states and click, it will change the information. This map that I'm pulling up here is on our, like I mentioned before, is on our website just for the member call today, but we will send you the updated map and the updated link for the map after the call. Okay. All right. So let me take you a little bit into the data. We know that child care, of course, is a significant burden for all families, but especially for low-income families. The federal poverty rate in 2014 was a little over $19,000 for a family of 3 in the continental USA. The cost is highest in D.C., but outside of D.C., it's Massachusetts. And 10%, as we know from our past publications, the Department of Health and Human Services recommends 10% of the family income go toward, no more than 10% of the family income go towards child care. And as you can see, the cost of care, ranges from 24% of the annual income in Mississippi to all the way up to 85% of income in Massachusetts. We talk about affordability. When we calculate affordability, it's the percentage of income required for a married couple family with their own children under 18 years of age to pay for 1 year of infant care in a center. The least affordable states for infant care for a married couple are Minnesota, Oregon, New York, and Colorado. Those percentages range from 15.1 to 15.2%, and literally they're pretty much tied. The difference between Minnesota, Oregon, and New York is 3 1/100 of a percentage point. For 4-year-olds, the least affordable places to do child care is New York, Missouri, Vermont, Minnesota, and Oregon. And for school-age care, the least affordable places are Montana, Wisconsin, Nevada, Hawaii, and Illinois. So, like I mentioned, even those families that we might not consider poor, families that are above the poverty line can expect to pay a significant portion of their income toward child care. And it ranges anywhere from 12% for these families. These are families with double the federal poverty threshold for income. It ranges from 12% for Mississippi to over 42% in Massachusetts. So it's still a significant portion of your income, and it's a burden for many families. For single parents, they're hit especially hard. And when you look at your state, you'll see that a lot of states have it's very unaffordable for single parents. Among the 50 states, the annual cost of center-based infant care averaged over 40% of the state median income for a single parent, for a single mother. And the least affordable states, of course, D.C. not being a state, but D.C. was the least affordable. But then we had Massachusetts, New York, Minnesota, Illinois, and Oregon. And for single parents, the cost of center-based infant care exceeds 24% of the median income in every state. So, you know, child care is a major expense for many family budgets. So we've said that over and over again. And like last year, it exceeds the cost of housing, college tuition, transportation, and food. So for college tuition, in 28 states plus the District of Columbia, the annual cost for an infant in a center-based care was higher than a year's tuition and fees at a 4-year public college. For housing, the cost of child care fees for 2 children exceeded housing costs for homeowners with a mortgage in 24 states and the District of Columbia. And in 2014, the average child care fee for an infant in a child care center was more than the amount that families spend for food in every region of the United States. And finally, for transportation, center-based care costs exceeded the cost of transportation in every region of the United States and the District of Columbia. So we did something a little bit different this year that we're excited about as well. The cost of care in urban areas, we know, is higher than statewide averages. Child care often means much more expensive in urban areas than in rural areas a lot of times. And what that means is sometimes that the statewide averages we're giving you can underestimate the cost of care in many of the heavily populated regions. So what we did, and this was just a pilot, we hope to do this with more metropolitan areas next time, but we obtained data from five of the country's metropolitan areas, and they were from the largest metropolitan areas. We were interested in looking at county-level cost data, and we also were, we had to work with organizations that we were able to get the data from. So like I said, this was a pilot to see how easy it would be to get, and then also to see what we found. We worked with Marion County, which houses Indianapolis, Indiana, Clark County, which is where Las Vegas is, Franklin County, where Columbus, Ohio is, King County, where Seattle, Washington is, and Milwaukee County, where Milwaukee is. And in every instance but one, the cost of care for an infant and a 4-year-old was greater than the statewide average. And on average, the annual cost for an infant in a center in each of the in the 5 metropolitan county areas that we examined was 22% greater than the statewide averages. For 4-year-olds, that figure dropped to 19.3%. And the comparable figures for family child care homes were greater than the statewide averages by 11, almost 12% for infants and 8% for 4-year-olds. So let me share with you some of the specific examples. Marion County, which includes the city of Indianapolis, as I mentioned. The average annual cost of care in the center was $10,477, or 17.5% greater than the state average. And when you're looking at family child care homes, the costs were about 5% higher. When you're looking at the cost for a 4-year-old in a center, it was about $7,000, a little bit over $7,000, which is about 14.5% greater than the state average. Let's look at Clark County, Nevada, which includes Las Vegas. Infant care in a center was about $10,465, or 6.2% greater than the state average. For family child care homes, cost was about 3% higher than the state average. 4-year-olds in a center, their cost was $8,766, or about 8% higher than the state average. And when you're looking at family child care homes, costs were about 3% higher than the statewide average. Now in this area, almost three quarters, 71% of Nevada's population resides in Clark County. So, and within the Las Vegas metropolitan area, even though you're not seeing that the statewide average it's not much smaller than this area. When you look at the metropolitan area in Las Vegas, there is marked variation of cost. So we found that the rates in infant care in the center ranged from $6,500 all the way up to $14,500 per year. The next one is Franklin County, Ohio, and this includes the city of Columbus. The average cost of care for an infant in a center was about $12,000. And that's about 36% greater than the state average. And for family child care, it's about 5.5% higher than the state average. For 4-year-olds, center care was about 31% higher than the state average. And for family child care providers, that was about 3% higher. You know, we basically, we also looked, you know, we asked folks in the counties to give us some idea of what might be happening. We realized that some of the costs for care might be attributable to the relative affluence in the area. Columbus is the capital of Ohio, and it's recently seen an influx of young and relatively wealthy families. King County, which includes the city of Seattle. The average annual cost of infant care in a center was a little over $16,000, which is 30.7% higher than the state average. For family child care homes, it was about 16.5% higher. When you talk about 4-year-olds in a center, it was about almost 25% higher than the state average. And when you're looking at the family child care homes, it was an additional 13% higher. We also found that considering that the average family income within the county is about 22% greater than the state average, parents in King County appear to be paying disproportionately higher rates for child care. One of the other things that is nice, though, is that increased burden is alleviated somewhat by higher state subsidy payments, the highest in the state for families in King County. So then finally, we look at Milwaukee. Milwaukee County includes the city of Milwaukee. The average cost of care for infants was $13,674, which is about 18% greater than the state average. For family child care homes, it was about 25% greater than the state average. When you're looking at 4-year-olds, again, we're looking at about 17% higher than the state average. Family child care homes, about 19% of the child care, of the state average. So now I want to turn it over to Michelle McCready, who is our Deputy Director of Policy, and she is going to talk with us about what we can do to make this a better situation for families and children across the country. Michelle, can you hear me?
I can. Can you hear me, Dionne?
I can. Hopefully everybody can hear us.
Wonderful. All right. Technology, when it works, it's great, right? Thank you so much, Dionne, and thank you all the participants on this call for carving out the time in your busy work days and schedules and your commitment to this issue. We really hope that these resources that Dionne went through are helpful to you in all of your different advocacy and policy work in your state. Ensuring that children have access to high quality and affordable early childhood programs can help children prepare for school and succeed in later life when, it also helps strengthening parents' ability to go to work and advance their careers and increase their earning potential. And as Dionne pointed out, and as Lynette opened the call with, the research is beyond clear that shows money spent on young children is an effective investment. It yields benefits immediately to the parents and to the workforce and the business communities, but also decades to come for children. We heard a lot about the data in this report. It does paint a pretty bleak picture about how children and families, our families with young children in particular, are really strapped when it comes to quality, affordable child care options. We know that low-income families in general are struggling with only 1 out of 6 families that are eligible to receive a subsidy are actually receiving it, and that's due to all types of challenges with wait lists, not even knowing that subsidy or support exists. And Dionne pointed out another one, which is non-traditional hours and having even access to that subsidy because of the time you go to work. Middle-class families are also burdened with costs and lack of affordable options. We pinpointed out in this report some of the county-level data. We know that urban-level areas are struggling with different challenges than rural communities, and we'd really like to explore more about what's happening at the community-based level in order to come up with solutions together. So I really wanted to talk about ways that we can take action. Lynette opened this by saying it is a pivotal time, and it really is. We've heard from the President in the State of the Union mentioning child care over 8 times. He quoted our cost of care report at a Working Family Summit, and the administration understands the need and how critical this investment is. We've heard from presidential candidates on both sides of the aisle about the cost. We're still, interested and excited to talk about solutions. So it's really not just a one-fix-all situation. We need communities, businesses, policymakers, parents, families, all involved working together to ensure that parents and working families have quality, affordable options. So what can you do? We have a Take Action Center on our website, and after this call I want to make sure that everyone has the link to all these resources that we've been talking about. What we currently have on our Action Center as an ask is for the President's budget. He makes a significant ask for his early childhood budget, and we would like Congress to support the President's proposal. That would be $82 billion in new mandatory CCDF over the next 10 years. So that's about a $53 billion increase over current levels. $2.8 billion of that would be for CCDBG, and as we all know, and we are very grateful for that incredible step that was taken a little over a year ago to pass the Child Care and Development Block Grant. Many quality health and safety provisions for the children in child care. We also know that increased dedication to resources to help states comply with new CCDBG mandates are really essential at this time where states are already grappling with a lot of child care challenges. Also, a $10.1 billion for Head Start and $1.5 billion increase over the FY16, including a $650 million to expand the Early Head Start and Child Care Partnership Program, which really raises the bar for both the Early Head Start programs and child care and brings communities together to make sure that parents have affordable, quality options for their parents, for their children while they work. There's also a $15 billion increase over 10 years for the maternal, infant, and early childhood home visiting program, our MIC-V. And really, we're talking about a continuation of quality services to low-income families here from prenatal all the way up to age 5, and in partnership with child care settings. And a $500 million increase for the preschool development grant, which a lot of states are implementing and would like to continue to and have quality preschool as an option in the partnership with child care. There's also requests to triple the maximum child care and dependent tax credit so that children age 5 can receive $3,000 per child, and that they're made available to families with incomes of up to $120,000. And there's also a need for a sliding scale fee to help low-income workers as well as middle-class families. You can go to the next slide. What also we know is that we want to make sure that here and now we have resources for families who are looking for quality child care options. So what we send them to, and then this will be on our website, is their local child care resource and referral agencies, many of whom are on this call today, that have information about local, state, and government grants, tax credit scholarships, and also helping parents find quality child care. And we have the different resources in the report to ensure that if families, parents, providers do come across that are looking for solutions, or what is out there for me if I'm looking for childcare, they have a place to go. We also introduced the Child Care Aware's Child Care Options Calculator, and this allows families to examine their financial situation both with and without the cost of child care. So as other calculators do, this would help really with the budget and say, okay, in order to afford child care, what does it look like for our family? Statewide averages are very helpful, especially for policymakers. However, each family has a different and unique situation, so this calculator is another resource for them. We also provide state-by-state resourcing maps through our Child Care Aware program, and that has a list of agencies and organizations that provide information for families regarding child development, parenting, child care concerns, and questions. So there's a lot of good resources for parents and a one-stop shop place where they can really access lots of materials related to everything from early development to quality child care. So the other thing that I think is helpful for families to know when they're making decisions about child care are about federal and state tax credits. This is incredibly important because when you're doing your taxes, there are several tax credits available, and you'll see the different ones up here. But there's the Earned Income Tax Credit, there's the Federal Child Care Tax, and the Federal Child Independent Care Tax Credit. And it's incredibly important for parents to know if they qualify and to advocate that these programs don't go away in the budget, since there's an incredible support to working families for all the reasons we outlined of child care being a hardship. These are a little, and these are tax credits are a little bit helpful to lighten the load. So I'm not sure if we have another slide with our emails on it yet. However, we can pull up our website and you can see where you can access all of these different resources. It's going to be at usa.childcareaware.org/cost-of-care. Tomorrow, when we're launching our new report live, you will be able to find there, one, our take action. So what I was just talking about as far as what we are asking in this critical time of budget cuts. A lot of Congress, government, local policymakers, they love to talk about the importance of children's child care and children's programs. However, we really hope these tools will help you hold their feet to the fire and say, you know, this is great that you support this. Now we want some meaningful investment. Also, we have what we will have on this page is that map where you can access your state-by-state data. Please use this. Send it to your congressional members, also your local policymakers, also your state child care administrators, to talk and get the conversation started about what is happening in your state. We really tried to summarize the most compelling statistics about each individual state under that map. And Dionne did a beautiful job of going through the map, so we hope, if you have any questions, let us know. But we hope that that's a useful tool to you. Tomorrow you'll also be getting several infographics that you have seen throughout the presentation about the importance of quality childcare and quality childcare options and the impacts and effects of lack of quality childcare options to parents and working families. You also receive a press kit or sample social media, tweets, Facebook posts, sample press release, so that you can use the materials in your own advocacy and outreach. If you have any questions, want some customized data or feedback, please reach out. We're very excited about these new tools, but we know that everyone is incredibly busy, so that's why we're here, to help make your jobs easier. And we really appreciate everybody, again, carving out the time through their busy schedules to have a conversation with us, join us in talking about raising your voice on the importance of quality childcare for all working families. So with that, I am going to pause. I hope that you all saw there is a chat box function on the lower right hand of your screen. You can pop it out and type in a question. If you have one, we may have some already. And Dionne, if you don't mind reading any questions we have out loud, or I'll give everyone a minute to ask the question if they have one.
Okay. One of the questions is, on the map, how do you determine or define home care here?
So I don't know if we're able to unmute Stephen. I know that he has the precise definition of home versus center based. However, I do know that it does vary in every state what is considered home versus based. Are you all able to unmute Stephen?
We're working on it. Stephen?
Hi. Yeah, I think I'm unmuted now.
Yes, you are. Thank you.
So for the most part, when we say family child care home, we're using information that has been provided by state administrators and various other officials at the state level. So for the most part, we go with whatever that state's definition of a family child care home is, because we want to make sure that that is consistent over time. But our official definition is care that is offered in the caregiver's own home, and depending on the state's licensing regulations, may be exempt or exempt from, or may be licensed or exempt from licensing.
Okay, we have another question. What did you have to do to collect the county level data? Was it difficult?
So in order to get the county level information, we reached out to the individual state administrators and membership agency members who were in the areas that we were already hoping to look at. We actually only heard back from about 50% of the administrators that we reached out to, so those are the ones that made it into the report. But it was in some cases it was a little bit more difficult than others. It really just depended on how that particular state collected their data.
Okay, it says another question, and we might have to ask this person if we don't understand. On the map, how do you determine or define, oh, we already heard that one, I'm sorry. When will this webinar be posted?
Tomorrow, when we release the report and make the website live, we will ensure that we have the recording up as well.
Okay. Stephen, I have another one for you. Is there a reason that you chose the median income of two-parent or married families on the measure instead of single parents or the overall cost?
We chose, or we examined both figures. We looked at married couple families with their own children, and we looked at single parent families. But for the most part, when the larger population was those of married couple families, so that's the one that we showed as a default on that.
Okay. And this is one about the media release. Could we receive a copy of the media release that we can distribute locally, including our state's relevant data?
I will provide my email address for those interested in getting a separate press kit before tomorrow morning at 6 a.m. You can just email me directly, and I'd be happy to send one over.
Another question about cost determination. How do you determine the cost for school-age care with children in care part-time during the year and full-time sometimes in the summer?
We excluded summer months in our cost calculations, or at least we requested that summer months be excluded for all of the states that submitted data. So this information is collected by a survey that goes out to each of the state administrators, and we provide a list of instructions to those people who are responding. And for the past several years, we've requested that summer month care be excluded so that we only look at the school year.
We are looking to change perhaps the way we collect the summer data. So, I mean, not the summer data, the school-age care data, and we're working with the work group now to think about the best ways to do that. So we appreciate your thinking about that. That is something that we have been thinking about. Another one, when looking at the county information, was it taking into account the significant amount of rural areas in some of the states?
I'm not sure I understand the question.
Okay, so this is from Marty Elquist. Let's see if we can reach her. Hold on for a second. Marty, can you hear us? I think I unmuted you. Let's see. Marty, if you want to send us a note, we can try to answer your question. Okay. I have another question here. Did you compare the cost of living to the cost of care figures?
Yes, we did that. We have an infographic that's within the report that wasn't represented on this webinar that it compares those figures.
Okay. I'm not seeing any other questions. Let's see. Feel free to use the chat feature or the question feature if you have any other questions. Of course, we're always available if you want to shoot us an email. You can email me at dionne.dobbins@usachildcareaware.org. Actually, we have a couple more questions. Will there be a social media and hashtag associated with this report? Yes. We're going to have a whole media toolkit that we'll be sharing with you. And the hashtag.
Oh,
sorry. the hashtag is cost of care. Go ahead, Michelle.
Yes, thanks. And we also are going to be partnering with Moms Rising on Thursday to do a tweet chat with them. They have a reach of, I believe it's over 1 million moms, at least, on their list, and we will be talking about this issue with them in their featured chat on Thursday, I believe, at forgetting the time right now, but we'll definitely be sending that information to this group.
It's at 2 o'clock.
2 o'clock. Okay, thank you.
Yeah. Yes, and you can check our Facebook page for more information. I have a good one here, and I think I'll have this one answered by Michelle, who helps us think about our advocacy work. Often the media wants to focus on the cost or the rankings. How do you suggest we turn that around?
That's a fantastic question. I think that we're all very used to, and we live in a culture of BuzzFeed and quick reports that say I'm top 5, I'm top 8. But really, what we hope to do with the map is really tell the story of your state. And what's even more beneficial is telling the story of your community. So again, a state picture doesn't necessarily account for or pick up the nuances happening in communities. For example, some rural communities, we talked about urban, that was the pilot that we looked at, but some rural communities, for a variety of reasons, have extremely challenging times finding and affording quality child care compared to their urban counterparts. So having that narrative, having that story, having parent advocates that can be at the ready and on call to talk to policymakers about the unique landscape of the child care situation in your communities is one of the best ways to really flip that around and not just be a soundbite or not just be ignored if you're not in the top 5, right? Because it's critical to talk about what parents are experiencing to the policymakers representing their community.
Okay, thank you. Someone asked who we're mailing, who do they get the press release information from? Again, that will be in the media toolkit. Won't that be in the?
It will be on the /cost of care page and the sample press release.
There will be a sample press release on this cost of care webpage that you can access tomorrow. One question here, what are successful strategies to promote the deep understanding of child care as an essential part of early care and learning?
I think that part of the toolkit and what really needs to get more attention in the narrative is the actual story behind what's happening in childcare, how many children are in childcare, how many parents and families are in need of childcare. So having that narrative is important, having the data to back it up, but also talking about the brain development and the brain science behind what's happening when children are in childcare or are in birth to 3, birth to 5 age range, and how so much brain development, critical brain development is happening, and that impact that happens throughout their whole life. And so marrying those two things, one, talking about the data, the science and the research, but also talking about the story of childcare and the importance of it to working families in your communities, really does get the focus on childcare being more than babysitting, being more than a place that kids go, right, while parents and families work, but really a critical workforce support and an early learning program that will help benefit them in generations in the future.
Okay. I'm not seeing any other cost of care related questions. Feel free, we have another 7 minutes or so. If you have any other questions, feel free to use the questions box. Okay, Michelle, do you have any things that you wanted to mention in terms of what's happening next, reminding people about the final report coming out and what they can do to get the word out to their media?
Absolutely. Thank you. Thank you all again so much for being on this call this afternoon. And to remind you of the timeline, we will have everything available to you, sent out both via email with our website, and you can visit our website. We'll have it live at 6 a.m. Eastern Time tomorrow with the Parents in High Cost of Care report, with the map, with the social media toolkit, including different tweets, infographics that you saw in the webinar today, and a press release. We have tools on our Action Center also for you to take action and send your members of Congress a letter about the important need for investment in quality child care. We also have an ability in our Advocacy and Public Policy Action Center to email your local press and send a letter to the editor and reach out to them in other ways. So if you have any questions about that, email me, email Dionne, and visit us tomorrow through the email that you're getting, but also on our website, usa.childcareaware.org/cost-of-care, to access all of these wonderful tools. So I think that's it. If there's no other questions, we will give you all 4 minutes to take a little break before your next thing. But again, thank you so much for joining us, and we really hope to highlight that this report and these tools highlight the important issue of working families needing high-quality, affordable child care. Have a great rest of your afternoon. Take care.
Thank you.